To start, how did you come to be aligned with the Leukemia and Lymphoma Society?
Well, to try and make a long story short, I was a practicing hematologist oncologist, had a research lab and did clinical trials for a number of years. I then did a stint in pharma. So on the other side of the clinical trial equation, doing early entry into human clinical trials. And through that, I happened to meet the chief scientific officer and the CEO of LLS through various different interactions over the years. And when they decided to hire a chief medical officer, they mentioned the position to me, and it seemed like a perfect way to use my jack of all trades career to its best advantage. And really, as a physician, you help patients one-on-one. In the pharma world, you hope you get a drug that will help a group of patients. But working for LLS, I really think that, it's an opportunity to change how we treat cancer, much more generally and globally. And that's very exciting to me.
That's great. So then, in your work now, currently, what are you seeing? What kind of COVID-19 related challenges are impacting patients with blood cancers?
Well, we have a call center where we take calls from patients. It is manned by an incredible group of social workers and nurse educators. And they are the primary connection to a lot of the questions that patients have had about things like, I'm being treated in a big city and I'm afraid to go to that city, or my treatment can't happen because my center has, the treatment center had an active case and so it's closed down for X number of days. There are a lot of sort of bread and butter kind of access issues that we're hearing about that are, fundamental to people getting the treatments that we've helped to develop over the last couple of decades. And for many blood cancer patients, these are life-prolonging and really potentially curative therapies that they need to get. And so trying to be sure we help patients find the safest place to get their treatment, help them get coverage. We're advocating for, insurers to be more flexible about patients for instance, if your center you can't go to and you need to go to a different office, that office might not be under your plan. And patients are frantic because they can't pay that out of pocket or out of network cost. And I think, not to be Pollyanna, but I'm hopeful that this will show us some ways that the system is failing for cancer patients and ways we have to change to adapt to exactly this kind of problem.
Mm-hmm. Yeah. So then you touched on treatments generally. Are stem cell transplants still happening? What kind of risks are associated with that treatment?
So the transplant world, and we've talked to our colleagues at some of the foundations that organize and transport stem cells, because most of the stem cell transplants that are being done are for blood cancers. And so our patients were also calling saying, or their caregivers saying, I'm worried my stem cell donor is in Europe and I'm starting my therapy. We can't travel, the person who is supposed to be the courier can't travel. Well, fortunately, that problem was solved by finding a special dispensation for those couriers. But the sort of risk of not being able to get the stem cells, the donor being sick and not being able to be harvested is quite extensive. And so centers are looking to only transplant those patients that absolutely cannot delay the transplant. And so unfortunately, that's leaving a lot of people in limbo, worrying, will my disease come back while I'm waiting for this crisis to abate? And I presume that it's different in different parts of the country. For instance, though, therapies, not just stem cell transplants, but cellular therapies like CAR T therapy, which is also very important for blood cancer patients. That's where it's approved. They've really come to a halt pretty much because there is a risk that a patient undergoing CAR T will end up in the intensive care unit and need a ventilator. And frankly, the hospitals can't take the risk of adding to their already stressed systems. So there are a lot of patients, who may have been in line for that, who now are also waiting and in limbo. So it really has been quite extraordinarily stressful for our patients and their families trying to figure out the safest way to do this. Not to mention the doctors. I really shouldn't discount how much the doctors and nurses are taking on their shoulders to try and keep people safe and also tide them through in the best way possible to avoid multiple trips back and forth, and any therapy that can be delayed, having it delayed. But boy, is that an awful double whammy for our cancer patients.
Yeah. So you touched a little bit on this also. Patients are feeling this. What about their caregivers? Are you seeing anything?
Well, it's already a big strain to be a caregiver. Just being careful about hygiene and isolation techniques for chemotherapy alone is tough, especially for a caregiver who's also working and going out into the world. That's just magnified with the precautions that need to be taken for COVID-19. And while cancer patients may not be more susceptible to getting it, if they get it, they're at much higher risk of getting, very sick. And so that sort of guilt and fear is magnified in a whole new way for caregivers. And many of them still have to, go out and even for simple things like shopping, but they're people who are working, and every day have to think, am I, did I get exposed, or am I carrier and sick and don't know it, and potentially harming the person that I love. It's really stressful. And so we're actually doing several educational efforts, some of them for our own staff who are hearing these stories, but also for patients and caregivers to understand not only the technical aspects of what do you need to do to help be as safe as possible, but now even more, how do you handle the stress and the anxiety, which is doubled because there's not just the stress and anxiety of you have a cancer diagnosis or your husband or wife or sister or mother, but you have to be triply careful not to get them infected.
Yeah. So what then do immunocompromised patients need to know about navigating this whole thing?
Well, not to do a personal pitch, but we did a really great webinar with Dr. Ruben Mesa from the Mays Cancer Center. And he and I both spoke about what cancer patients and their caregivers need to do, how to interact with your physicians, what you need to do around the house, how the steps to protect yourself. It is just the same information that we're giving to everyone, but magnified. That it has to be even more cautious, and that may mean that family members may need to, do FaceTime and not visit. And it may mean a lot of things that make an already hard road even harder. But at this time, it's so critical that we have a lot of resources that people can read, look at, view, listen to help answer those questions and to sort of reinforce that. I've found for patients that they're hyper aware, and usually the caregivers are hyper aware and have been gathering this information. It's the next level of concerned family members that may not really understand how important their role is in protecting the person who has the cancer diagnosis. And for them, I'd really encourage to go to our website and get that information and hand it over to your teenagers and to your your cousins and your aunts and your uncles and your family members who desperately want to help and do something. What they can do to help is not be around.
So what other things is LLS are they working on to kind of help patients right now?
Well, we not only do we have the one-on-one support, but we have 54 chapters around the US and Canada. And those chapters have both patient access folks or patient facing experts who talk to patients, who normally would help coordinate conferences and learning sessions. And we have volunteers who do one-on-one. Many times it's a patient talking to a patient about their diagnosis. Well, this is even more important now. And so our folks are reaching out, but patients who've not connected to LLS should reach out. We can connect, at the local level with a lot of resources that are available locally. Our people are calling our patients and checking in on them and seeing what they need and helping them find resources. Another thing that's really important to mention is that we have a lot of support resources that are not personal support. We have financial support, travel support, and copay for medication support that patients can find out about and take advantage of. Obviously, there's never enough funding for this, but we're working as hard as we can in a really tough environment to be sure that those support resources are available for patients who need it. We understand a lot of people are furloughed or losing their jobs, and this can mean real financial difficulty for things like food and rent and electric bills. And as much as we can, we'd like to do our part to help with that as well.
That's great. So lastly, do you have any just advice for patients who are going through this, scared and just need some attention?
I think being as educated as you can about what's reality and what's not is the most important thing you can do for your physical and your mental health. I find that I have to turn off my devices because it's getting me too anxious. And I'm a hematologist oncologist with, decades of experience and expertise, and it's freaking me out. So I can only begin to imagine how it is freaking out someone who is dealing with a cancer diagnosis and that uncertainty. You must go to resources, go to the CDC, go to the LLS website, go to respectable websites to get your information. Do not remember that the local networks and the outlets that are media outlets primarily and not scientific outlets are trying to sell their media, right? And so they're looking for the sensational. You know, it's fine to understand numbers, but you need to turn it off and get the information from the right resources and believe what's being said. The other piece is, you know, when you see that information, get it to the people around you so that they understand too. And don't get caught up in all the frenzy, because it's already a frenzied time. Be a smart consumer.
That's great. Well, thanks so much for joining us today, Dr. Nichols.
Well, thank you. I really appreciate it, Jessica.